Hello and welcome to the June 12th episode of APHA's 15 on COVID-19 series. I'm your host, Dan Zlott, Vice President of Education here at APHA, and today we're going to be talking about telehealth. Now, for the first time on the 15 on 19 series, we have a guest host joining us, and we are in for a real treat. We're going to be talking about telehealth, and our guest host today is Sandra Leal. And Sandra is hands down one of, if not the most knowledgeable pharmacist on the topic of telehealth that I know. So let me just give you a little bit about Sandra's background. Sandra is the Executive Vice President of the Health Plans and Payers Division at Tabula Rasa Healthcare and the Chief Executive Officer for Sinfonia RX, which is a national provider of medication therapy management services. Dr. Leal's work has been widely published in a number of journals, including JAFA, AJHP, as well as the Institute of Medicine. She's received numerous awards, including 2 Pinnacle Awards from the APHA Foundation, as well as the APHA Good Government Pharmacist of the Year Award for her advocacy work related to provider status. Dr. Leal has also been very active in a number of associations, and she currently serves as the President-elect of the American Pharmacist Association. As I mentioned, Sandra has extensive telehealth experience, so we are so thrilled that she's been able to join us today. So without further ado, let's go ahead and jump in. Here are your disclosures. Dr. Leal is employed by Sinfonia RX, a Tabula Rasa healthcare company. And here are your learning objectives for today.
Hello, my name is Sandra Leal, and I'm President-elect of the American Pharmacists Association and Executive Vice President for Sinfonia RX. Today, I wanted to speak about telehealth advocacy, the new frontier. We as pharmacists have been advocating for a number of things, including provider status, for many, many years now. But I really wanted to focus on telehealth advocacy because we are seeing such an incredible surge of telehealth in these last few months with COVID-19. The time is really now. With COVID, the adoption and acceleration of the use of this innovative tool has been tremendous. People have started using this in weeks and months, what would have taken years to really adopt and embrace before. And this surge in adoption has really been to fight the status quo. I sit on a board here, a local health board, and the providers there who were resistant to using telehealth pre-COVID are now really finding that it has been an incredible tool for their practice. And they can see themselves now using this tool post-pandemic more routinely rather than be resistant to it because of things that they perceive to be barriers like the relationship building that really hasn't panned out to be the case in a lot of their patients. So that's very promising. I feel the same is happening with pharmacists now looking at this tool and connecting to their patients in order to prevent exposing their patients from coming in, but then also to think about things like access to care issues or transportation issues moving forward. The adoption of telehealth has been tremendous, especially in the last few months. If you look back at March of 2019 to March of 2020, you see an almost 4,300% increase in telehealth claims in that time. And as you can imagine, that has probably resulted in most of those visits within the last couple of months with COVID-19. In March of 2019, there was a huge focus on mental health as a primary telehealth encounter. And we know that telehealth was already being used for behavioral health for a while now. What we now look at and what we're seeing with these top 5 diagnoses is that in March 2020, the mental health encounters have dropped by almost half. And that's likely due to the fact that now telehealth is really being used for a number of different encounters for chronic conditions, really to offset the loss of inpatient or in-office visits. Even before COVID-19, CMS, or the Centers for Medicaid and Medicare Services, were already looking at telehealth legislation and looking at some of the potential opportunities. But with COVID-19, there has been more flexibility that has now been created. For example, there is now no limitation on the originating site requirements. And then the originating place of service, which had some limitations, now add the patient's home. And I think that's one of the most significant additions, because now people can stay at home to have an encounter versus having to be in one of these specific areas. Additionally, the equipment requirements have become more flexible during this period of time. Before, you were required to have HIPAA compliant audiovisual equipment, and now people can use applications like FaceTime or Zoom to be able to conduct these visits. I think one of the most challenging areas of telehealth, and really where we need to continue to advocate, is in the provider type. This goes back to our continuous dialogue with CMS and with lawmakers about inclusion of pharmacists as providers, because in the existing telehealth legislation, pharmacists are not one of the listed providers. And even though telehealth flexibilities added additional types of providers, it did not include pharmacists. So they added physical therapists, occupational therapists, speech and language pathologists, but pharmacists were not included. And so this is where we have to continue to challenge the norm and try to get ourselves added into this legislation. Now, patient types was also expanded. In existing telehealth legislation, you had to be an established patient. But with the flexibilities, now we have new and established patients could participate in telehealth encounters. One of the other areas is in regards to supervision. With existing telehealth, there is no supervision. It's not applicable. But now with telehealth encounters, general supervision is allowed within the COVID-19 flexibilities. CMS has broadened access to Medicare telehealth services so that beneficiaries can receive a wider range of services from their doctor without having to travel to a healthcare facility. These policy changes build on regulatory flexibilities granted under the President's Emergency Declaration. CMS is expanding this benefit on a temporary and emergency basis under the 1135 Waiver Authority and the Coronavirus Preparedness and Response Supplemental Appropriations Act. Under this new waiver, Medicare can pay for office, hospital, and other visits furnished via telehealth across the country and including in the patient's home, starting March 6th of 2020. A range of providers can participate in this, but unfortunately, pharmacists, again, were not one of the listed providers. An additional benefit is the Office of Inspector General is providing flexibility for healthcare providers to reduce or waive cost sharing for telehealth visit paid by the federal healthcare programs. Prior to this waiver, Medicare could only pay for telehealth visits on a limited basis when the person received the services in a designated rural area or when they leave their homes and go to a clinic, hospital, or certain other types of medical facilities for the service. As mentioned before, even before COVID, CMS had made several related changes to improve access to virtual care. In 2019, Medicare started making payments for brief communications or virtual check-ins, which are short patient-initiated communications with a healthcare practitioner. Medicare Part B separately pays clinicians for e-visits, which are non-face-to-face patient-initiated communications through an online patient portal. Medicare beneficiaries will be able to receive a specific set of services through telehealth, including evaluation and management visits, common office visits, mental health counseling, and preventative health screenings. And this is to help ensure that Medicare beneficiaries who are at higher risk for COVID-19 are able to visit their doctor from their home without having to go to the doctor's office or hospital, which may put themselves at risk or others at risk. The table below is a summary of Medicare telemedicine services. It really describes the type of services that are available, what the service is, the codes that are being utilized, and then the patient and relationship with a provider. I highly encourage you to visit CMS and look at the fact sheet that is linked here below under the source. There is a lot of information that cannot be covered in this brief 15-minute presentation, but hopefully you can use the resources that will be offered for you to have the opportunity to go back and to review them. A resource that I have been finding extremely helpful with all of the incredible changes that have been happening is the Center for Connected Health Policy. One of the things that this resource brings is really a focus on the changes that are happening with telehealth for the national level, but then what it also allows for is a look at the state action that is happening. And so I just wanted to pull an example for you as you're looking at what's happening in your own state so that you can keep up with that. I've said a number of times already that pharmacists are not one of the listed providers, but that doesn't mean that you do not have the ability to use telehealth. In fact, there might be some state opportunities or opportunities with commercial payers that still allow for you to implement and utilize telehealth in a way that you maybe haven't used it before. So don't feel like you're restricted, but maybe look at those opportunities to continue to advocate for your role. But I wanted just to pull out what a state action information sheet looks like. In that source, when you go in there, you will actually find related state actions for COVID-19 with a timestamp that shows the most recent actions within the states. And then within that, there are different states listed. So I live in Arizona, and I pulled out just an example of what's highlighted in this resource. It talks about action taken, some of the temporary expansions with Medicaid by state, some of the eligible services and waivers that are actually listed within the state model. And in here, what I listed is our state governor and what he did for an executive order for Medicaid specifically. So again, different from Medicare, but what it does show is what the flexibilities are within the state. It includes the types of examples for that state's restrictions or flexibilities that are now allowed. And a lot of them might mirror the Medicare changes, but you might see something that might be very useful to you as you're looking at specific state action that might be something you can apply. So go back to that resource again and then try to find your state to see what opportunities might be available to you. One of the most asked about questions or things that people have been wondering about is, are these flexibilities going to continue post-pandemic? And that is something we all want to know. I think that some of the flexibilities are incredible, like the ability for patients to be actually able to be seen at home and not have that restriction is incredible. That actually allows a patient to stay there. When you look at some of the barriers patients have experienced historically, if you have to go to a facility to be able to access telehealth, it sort of defeats the purpose. And so one of the things that just occurred is that Representative Robin Kelly just introduced a bill to Congress on June 1st that would mandate a study on the effects of telehealth changes on Medicare and Medicaid during COVID-19. And so this bill is called Evaluating Disparities and Outcomes of Telehealth During the COVID-19 Emergency Act of 2020. And it would require the Secretary of Health and Human Services to conduct a study within a year of the end of the emergency period to summarize the healthcare utilization patterns during coronavirus. The hope is that we can actually identify the benefits of having had that flexibility and hopefully will allow for retention of some of those flexibilities that were afforded during the coronavirus. Now, there has been historical concern about fraud with utilization of telehealth, but hopefully this kind of initiative actually shows that the benefit or the return on investment from utilization of telehealth is going to far exceed any potential concerns that people have about it. So what can you do? Earlier when I started this presentation, I talked about telehealth, the new frontier for advocacy. We as pharmacists have been advocating again for a number of things, but I really feel that telehealth should become a priority in focus for us as we advocate for inclusion in this legislation as providers. I truly feel that you can advocate in many ways, definitely locally within your institution to have access to patients and to be able to use technologies to reach those patients. Within your pharmacies, absolutely advocating for yourself and your role, but also at the state level with Medicaid plans and Medicaid legislation, and then absolutely at the federal level. And the fact that you're involved in these presentations, you're already probably very active. But continue to send letters of support as APHA continues to engage with CMS and as we continue to advocate for the profession. The other thing I really want you to consider is pursuing direct contracting opportunity with payers. You don't have to wait for the law to change in order for you to start looking at payer contract opportunities. When I'm out there speaking with payers, we're constantly looking at ways to show our value, to look at value-based metrics and show how telehealth can help us achieve that, to lower risk for the patients, to improve access for the patients, but then also to provide customer service opportunities for retention. If people can access your services, and not have to necessarily physically come in, that might actually open up a customer base that might have not been available to you because of geographic limitations or barriers. I'm also always constantly thinking about people who are underserved. I sit on another board called the National Center for Farm Worker Health, and some patients who are farm workers cannot get to appointments because of restrictions by their employer, because of challenges with transportation, because of many different factors. And so now, if a person can actually access care through a telephone or through a application that they have access to, this now provides a whole level of access that was not there before. So the benefits of this are incredible. I can't state that enough. And so hopefully you can get activated and engaged in advocating for this as one more thing that you're trying to do as you work towards making sure that the profession really is continuing to be in the front lines and an accessible primary care provider for those that we serve. With this last slide, I just want to identify some resources that have been very, very helpful in trying to identify a lot of the changes that are happening very quickly. So absolutely, the APHA Pharmacist Guide to Coronavirus site has been incredible. There are a lot of CEs there. You've been participating in them. But just recently, within this past week, APHA released a Telehealth in Your Pharmacy Practice fact sheet. It's a really great document that has some frequently asked questions related to telehealth services, and hopefully you will find that very useful to you. The Center for Healthcare Policy, which I referenced earlier, has both national and state specific information that will be very, very local to your area of practice. So hopefully you can keep up with that and go and visit that. And then finally, the source of truth, as I like to call it, is Medicare itself. And so if you look at the Medicare website, they have a number of fact sheets, updated information about the billing codes. And so always try to look at that information because there are a number of changes that are happening. So with that, I thank you for your time this morning, and I can't thank you enough for all the work that you're doing to really help patients during this very, very significant time.
So that will wrap up today's 15 on COVID-19 episode. Thank you so much for joining us, and a big thank you to Sandra Leal for guest hosting for us. That was incredibly informative. As always, if you have questions about COVID-19, please send them our way. There are still a ton of unanswered questions out there, and we continue to receive those. So thank you so much for keeping those coming. Please join us on Friday, June 19th for our next 15 on COVID-19 episode. Finally, we also have some new randomized controlled trial data looking at post-exposure prophylaxis for hydroxychloroquine. So we'll review that, take a look at the quality of that study. So we hope to see you next Friday. Until then, stay safe and thank you.